Welcome to the morning formation. Warriors fall in. It's time for formation. Welcome back to the Morning Formation podcast, where we have real conversations with folks who know what it means to adapt, overcome, thrive under pressure. Today, we're diving into an important topic that affects so many of us out there: men's health and performance. And today, I'm joined with two special guests from Ultimate Male: Matt Schaefer, a former Cal football standout with a deep understanding of athletic performance, and Yuan, the clinical manager over at Ultimate Male, who keeps the operation running smoothly and ensures every client experience is top tier. Together, they're helping men, especially those in high stress careers like the military and law enforcement, optimize their health and regain vitality and stay in the fight even longer. So gentlemen, thank you for joining me on the Morning Formation today. Let's jump into it.
Sounds good.
All right. How was your day today, fellas? Did you enjoy the 100-degree weather out here in LA?
Oh yeah, it's so hot. We got so many cancellations today actually because of the weather. People are just not standing the weather well.
But I'd like to add that our clinic is actually really comfortable. It's beautiful and clean. It's an enjoyable experience for everyone.
Yes, I can attest to that. They do have a really nice AC unit there. Speaking of which, so Matt, since you're talking about the hot weather, let's talk about your days when you were on the gridiron. How does your background, being a former D1 athlete, play in the role of what you're currently doing with Ultimate Male?
I don't think anyone's ever asked me that before. So I went to UC Berkeley and played football up there. I started off as an offensive lineman, but then transitioned into a tight end. Just obviously the physical requirements, the mental demands. I know exactly what it takes to, like you said, thrive under pressure. And being a D1 college athlete really helped me to understand the importance of the teamwork. And I've used that knowledge to kind of propel my career forward.
Yeah, that's really interesting because I think that when it comes to different positions that you do growing up through life, I think the D1 athlete is probably the apex position because you guys are literally top performers from all over the country. You're going against other top performers from all over the country. So I give a lot of the D1 athletes like major kudos for managing the education side of it, but then also managing the side of staying on the field. So that's huge. I think people can relate to that, the people that you serve today. Wouldn't you agree?
Yeah, I mean, 100%. You make it sound like this giant thing. I was just a big guy that was good at a sport.
You're too.
You know what I mean? Like
you're too humble, bro.
Yeah.
I mean, because I played football in high school, and there's no way I would have been able to play at that level.
Yeah, I mean, I was pretty heavily recruited for sure. I was Long Beach Press Telegram, like All-American, whatever. Got recruited heavily by schools all over the country. Back in the day, so I graduated high school in '99, and back in the day, the schools would fly you out there if they were recruiting you, and you could go on like 5 official visits. I went to Oregon, Texas A&M, Colorado, Berkeley, and Arizona State, right? And my parents basically told me that I would be an idiot for not going to Berkeley, and that's how I ended up there. Yeah, so I was there from '99 to '04.
Yeah, they were looking out for the academic side of everything, right? So
Yeah,
not
obviously.
so much. They're not really known. I mean, I guess they are kind of known for football, but yeah, man.
We went 1-11 my first year. We were not known for football at the time. We beat Rutgers. Yeah,
Everyone beats Rutgers. I mean, that's like, yeah, everyone beats Rutgers. So,
yeah.
Yuan, I want to talk to you, man. So, can you give us just a brief story of the origin of Ultimate Male, the business, and how the clinic came to be?
Yes, definitely. So Ultimate Male started out as a place that is basically made to help men in thriving, giving them hormone replacement therapy until it reaches this stage where it takes care of preventative health, lab tests, weight loss, and everything that we do for the men and the organs that specifically are for the men. I think it's evolved in a way that where we can service more people and give them the best care that they deserve.
Yeah, Ultimate Male, from what I've seen over the years, is really cutting edge. You guys seem to be like at the forefront of the latest and greatest. What would you say, and either one of you can actually take this question, what would you say would be the difference between Ultimate Male versus other men's clinics?
Well, there's a couple things actually. I think having to deal with like real people that have lived real lives. I'm not some nerdy doctor that, just went through high school and got straight A's and then went to college and didn't have any friends and just studied and has never had a real job and then got into medical school and just studied and didn't have any real friends. They just had their little study groups and then they go
Right.
through residency and they get shit on, and they come out and they're just completely out of touch with people. And not to say that there's not great doctors. Obviously, there's wonderful doctors in the world, right?
Right.
But I mean, we're just real people, like we've lived real lives and had real experiences. And I think that's kind of what sets us apart, is that we can relate to people. Like half of our clients, maybe 3/4 of our clients are military guys, firefighters, police officers, and like blue collar guys, plumbers, electricians, linemen, dock workers, all that kind of stuff. That's kind of the first thing that sets us apart. Secondly is our like comprehensive suite of services, right? So it's not just, not just like hormone optimization and erectile dysfunction, but we also do like Botox, filler. We do a lot of hormone optimization for women. We do microneedling, laser therapy, medically managed weight loss. We have a whole bunch of stuff that we do. And that's really what sets us apart. There's a ton of these TRT clinics around, or these like online operations where you don't know where you're getting your medication from. It's coming from some shady pharmacy in Florida and you don't know if you're ever going to get your medication on time, right? We're real people. You just come into the clinic, you say hello, and, we'll give you everything that you need and take care of you along the way.
I'm so glad you said that, because that's really important to me, that I'm not getting my stuff through the mail, but I'm actually walking in. I can ask the dumb questions and I can get answers right then and there versus like having to email someone. I think that's huge when it comes. And then for folks being able to just relate, like you said, Matt, you're a former Division I athlete. So like, what it, and then also I didn't even mention, Matt, but would you mind covering a little bit about some of your experiences working as a medic as well?
Yeah. So when I left school, I had no idea what I wanted to do. One of my best friends is a fireman. He's a couple years older than me, and I was working some job that I couldn't stand, and he asked, what I was doing with my life, and at the time I had no idea. And he said, why don't you go to EMT school? And so I was probably 22, 23 at the time. And I said, sure, why not? I actually followed up with him and went to EMT school and then, graduated and was an EMT for a couple of years. I worked as a ER tech at UCLA Santa Monica Hospital for a few years. And then went back to paramedic school. I went to paramedic school at UCLA and I was a paramedic for like 10 years before I went back to PA school. So I've kind of lived a whole bunch of different lives, actually.
That's super interesting, man, because I mean, the fact is like your whole journey and your career track, it falls right in line with your customers being able to relate to you and probably feeling a little bit more comfortable about where you've been and what you've done before. And I think that's what makes Ultimate Male different than other TRT businesses out there, and other, health services out there and things like that. And either one of you guys can answer this question, but what core services does Ultimate Male offer specifically for men over 30 or 40 years old?
Definitely our testosterone replacement therapy. Definitely recommended for anyone over 35 years old to at least get checked out, see where their levels at, what might be affecting their lives, like loss of sleep, loss of libido, getting no motivation, easier to build fat instead of muscle. Testosterone could really help a lot of men, and we've seen it with our own eyes. We've diagnosed probably like hundreds of men now with low testosterone, and them on their journey. We do frequent lab tests, though, not unlike other clinics. To get on our past topic, it's not like other online clinics or even clinics around Los Angeles that doesn't really care about their patients. We do regular and routine follow-up lab works and the follow-up with the patients via message, have them come back to do consultations, discussions with us, so they feel cared and we actually care about them. I think that's what set us apart from all the other clinics out there.
Yeah, I can tell you, like, even I've been with Ultimate Male for a while now, and I've always gotten that personal touch. Like, I've always been comfortable with walking in there and asking questions, no matter how dumb they are or whatever. And for folks out there that are concerned about the whole, like, TRT thing and, like, some of the disadvantages that come to it, like with the red blood cells, all that stuff like that, how do you guys counter that? Like, what do you do to help out folks that want to stay balanced but are also looking to improve their lives?
This is starting to sound like an infomercial for Ultimate Male, but yeah, no, it is. Yeah, totally. No, I mean, it's a wonderful medicine, right? Like, but it's a medicine, and all medicines have potential side effects that you need to be aware of. And I also want to clarify, like, testosterone is not a magic bullet. It's not going to solve everyone's problems. It will probably give you some more energy and allow you to sleep a little bit better, and regulate, brain, like, neurotransmitters but if you just sit on the couch and eat Doritos and inject testosterone, like, you might feel a little bit better, honestly, but you're not going to have any of those body composition changes that a lot of people are looking for. You might get a little increased sex drive, but you're probably not going to get laid all that often. But no, yeah. So testosterone's it's a wonderful medicine. I think the two big concerns that I really have with it is the decrease in testicular efficiency or functioning while you're on testosterone, and then the increase in red blood cell production, right? Erythrocytosis. The normal range for testosterone is 300 to 1,000 nanograms per deciliter. All we do is we bring guys up to the top quarter of the normal range, right? So when men are like 18, 19, 20 years old, we're kind of all functioning at a very high level. Our testicles are functioning at like a very high level. And as we get older, just like anything, our testicles start to break down over time, right? They become less efficient. There's a threshold that every man will cross, whether that's 30 years old or 45 or 50 or 60, whatever. It doesn't really matter. There's this threshold that every man will cross. And once they cross that, they become symptomatic to those low testosterone levels, right? So the things that we're looking for are going to be like decreased energy, decreased libido, increased fat retention, decreased muscle mass or inability to put on muscle at the gym, poor sleep quality, poor erections, less morning wood. I mean, all those things are signs of decreased testosterone levels. And if those are, if you're experiencing those, like, go get it checked out, because it really can make a difference,
Yeah, I mean, I guess at the end of the day, we are trying to capture those clips that are gonna make sure that we put Ultimate Male in a great light. But I'm just generally curious too about a lot of these stuff, because some of this stuff I haven't really asked before, but I've kind of done my own research on. And when it comes to getting tested, if somebody walks through your doors and they don't know like where they're at, like with their own levels, what's that new first time experience going to be like for that person?
So first time patients will get them in for a free consultation. Essentially, during that consultation, Matt, our provider, will go through how exactly testosterone works, everything in detail, and what the side effect profiles are, what you can expect, and some solutions for that. Specifically for like lowering testicular function, we have stuff like HCG, Pregnol to counter that. And so there are many solutions essentially for patients that wanted to get care. But to get to the topic, we get them in for consultations, draw their blood on site if they agree to it. We do send our labs to a third-party lab to get them tested to avoid conflict of interest. After that, we'll have them come back for a review labs. It basically go over the lab test. We test it in detail, one by one. We test for testosterone, PSA level, your CBC, and estrogen level. So that's what we typically do for pre-screening testosterone. Essentially, Matt will go over everything in detail and then decide with you if testosterone is a good option for you and if you are a good candidate as well.
Yeah, absolutely. We'll just sit down and have a conversation, right? And I'll ask you about, your history, what kind of symptoms are you experiencing, what medical problems you have, any allergies to medications, the basic stuff, right? And then kind of run through the spiel that I just told you, like the normal range of testosterone is 300 to 1,000, and like what we're trying to do. We're just trying to make guys feel like they're 18, 19 years old again within reason, right? Like, right. That's the whole idea behind this. It's about just functioning at a higher level. When our dads were our age, in their 40s and 50s, they were getting fat and slow, and they just looked older, right? And like, we don't have to deal with that anymore. We've got a solution for that now, and it's safe. I mean, testosterone's been around for 100 years, right? Like, It's safe if done well, right? It's not that there's not potential, downsides to it. Obviously there are, right? But it's a great solution for a lot of guys, especially like military guys, especially like first responders, firemen, anybody that uses their body for a living. You can be functioning at a high level into your 60s and 70s. That was never the case before. I'm so happy this has kind of gone mainstream.
And in reality too, it also helps us sleep, right?
Oh, 100%. Yeah. I mean, I'll tell you my story. I'm on testosterone. I've been on testosterone for like 3 years now. The way that it kind of works is like, if we decide collaboratively that it's a good idea to start testosterone after we've had a conversation, we've done your blood work, right? Like we think it's a safe option for you. a lot of times, if I don't think it's a safe option, I'll have you go get checked out by urology or cardiology or whatever the case may be, your primary care provider, before you come back in. I'm not going to just put people on testosterone just because, right? Like that's not good medicine. But my personal experience was I had, really low testosterone levels. When I first tested like 3 years ago, I was at like 250 or something like that, which as a 40-year-old dude, that's pretty low, right? Yeah. And so I was like, shit, I need to hop on, right? So I hopped on and I didn't notice anything for like the first 7, 8, kind of 9 weeks. And seems to be like the average experience, is like people don't really notice much for the first like 7, 8, 9 weeks. And then there's kind of this gradual on-ramping of where they start to feel better. For me, it was my sleep. My sleep improved like drastically. I didn't even realize I was sleeping that poorly, but like my wife noticed first. She was like, dude, are you sick or something? Because you're sleeping so much longer and so much deeper. And I was like, no, actually, I feel great, and it didn't dawn on me that was the testosterone that was causing that. But then, I noticed increased energy levels. And I can't speak to like if that was because I was getting better sleep or if there's some other like physiologic mechanism that's occurring, like a cortisol suppression mechanism or some other pathway. But yeah, my energy was increased and then my motivation. And then like a week later, so like around the 9 or 10 week mark, my libido went through the roof, right? And that's when I was like, oh shit, I know what's going on here, right? And so this is the pretty average story. I mean, everyone's a little bit different, but this is the pretty average story, is that like, around the 10-week mark is where it kind of really kicks on. You'll go through this like what we call a honeymoon period or a Superman period for 3 or 4 months where you feel great. It's not like a high, but you'll feel super confident. You'll be sleeping great. You'll feel strong at the gym. Your recovery's crazy. You'll have a great sex drive, and that whole thing lasts for like 3 or 4 months, right? And then about like the 4 or 5 month mark, you kind of taper off, right? It becomes, your body becomes tolerant to it. It just becomes like natural to you. The good thing is that you remember before how you felt and you realize now that you like feel way better. You're still getting all the benefits of testosterone. You're still getting the recovery. You're still getting the increased bone density. You're still getting the sex drive, right? But it just feels normal to you. It's just your new day-to-day life, right? Like when guys come in, their baseline's down here, right? And if at like the 4 or 5 month mark, their baseline's not up here, like there's no reason to do this. It's just costing money for no reason. Like you're not getting any benefit for it. And so like, that's why we talk all the time and we run labs.
Have you turned people away before because you're like, you're fine, you're where you're supposed to be?
Yeah, 100%.
Yeah,
100%. Yeah, yeah. I mean, like it's a business, obviously, right? But like,
right.
There's medicine. Like we have to do good medicine. Like there's guidelines we have to follow. And if people are coming in, like I get a lot of people that are coming in for like aesthetic reasons, right? Like they just want to look good in the gym or look good naked or whatever, right? Like, and if they'll come in at 600-700 and it doesn't make sense to start them. Like it's just not safe, especially younger guys that don't have kids yet, that want kids in the future. That's a huge thing for me. I'm not going to start somebody like that. But with respect to like the first responders and the military guys, a ton of these guys we've seen over the years that these guys are coming in with really low testosterone levels, which is kind of the opposite of what you'd expect, right?
Right.
Like you expect these like really masculine dudes to have high testosterone levels. But I mean, the reality is that like if you're doing shift work, right? Like if you've got like brain injury, a TBI or anything like that, like your hypothalamus, pituitary, gonadal axis is going to be all fucked up, right? Like your testosterone levels are going to be in the tank, right? You're probably on too much, you're probably drinking too much, right? Or smoking too much weed or whatever the case may be. Your diet's probably shit. Like your testosterone levels are going to be really low. And that's where this like really can help people. I think that's a huge benefit to it.
That's what I love about talking to you, because you go in depth on actually explaining the topics, but then also bringing it down to a level where like I can understand what you're saying.
Yeah.
Because I've had people talk over my head before about this kind of stuff, and I'm like, what did you just say? So it's nice to actually hear and understand and acknowledge and keep up with the conversation, because when you get into medicine, sometimes that's not my forte. You mentioned earlier that if you get on TRT and then you decide to just lay around and eat Doritos, like that's not really going to help you all that much. But do you guys partner with anyone to help with nutrition as well? Or do you guys do that too?
Actually do. We do have a nutrition partner and a private trainer, the full gym in Monrovia and I believe Arcadia.
Okay.
So if patients want to get personalized training, personalized nutrition, or even physical therapy, we have partners for that. So basically, we're a one-stop shop for anyone that comes in for physical therapy, peptides, testosterone, men's health, ED treatments, anything that would benefit their lives. We basically do it here.
Yeah, I mean, I also work at an emergency department, right? So I have access to some of the top doctors in Los Angeles. I use urologists, cardiologists all the time. So if guys come in and there is some like extenuating circumstance, like benign prostatic hypertrophy, like BPH or enlarged prostate, or they've got Peyronie's disease, something that we can't handle in the clinic, right? Then or concern for like prostate cancer, for example, like I can give you the names and contact information of some incredible doctors, and that's a huge benefit too.
I'm glad that you guys are debunking a lot of the, myths, and you're handling a lot of the frequently asked questions right now. And one of the things that I know a lot of people are concerned about is like their job. Like they have to keep it legal. Like you can go buy steroids, TRT, all that stuff on the street if you want. But the thing is, if you got to keep this legal, you guys offer prescriptions, like actual like written prescriptions to where they can take it into their work and they can say, look, I'm on this prescription right now.
Yeah, I mean, you can travel with it anywhere in the world. It's just like high blood pressure medication or diabetes medication. It's a prescribed substance. MMPI prescribed medicine, right? It's a controlled substance,
Right.
Schedule 3 controlled drug. So you
Right.
better have that prescription bottle with you.
Right.
I've talked to a bunch of cops, police officers that I work with, or that are some of our patients, and if they find a bottle of testosterone, like if they pull you over and just incidentally find a bottle of testosterone, they're sure as shit gonna look, start looking a little closer, right? So, but if you got that prescription, it's just like any other medication. You can get on a plane and fly anywhere in the world with it.
We always prescribe them with the orange pill bottle, so it is prescribed medicine.
Right.
Yeah. So always keep it in the bottle.
And you just mentioned law enforcement, first responders. So might sound like a dumb question, but people out there are asking the question, like, is TRT safe for guys who currently work or have been in high stress roles like combat or like changing shift work, like law enforcement or even military if you've been deployed during war?
Yeah, I mean, I don't think it. I don't think it's any question that it's like a huge benefit to guys like that.
People
right?
hear like roid rage and things like that. Like, is that a real thing?
No. What testosterone seems to do is increase risk-taking behavior. At least that's what the data shows. But like in reality, like the clinical day-to-day experience is it makes you more of who you already are, right? If you're an asshole, it's going to make you a bigger asshole. If you're a happy person, it's going to make you happier. But it's subtle. It's not these things where you're going to just all of a sudden start beating, people with a baseball bat because, they cut you off in traffic or whatever.
Right.
It doesn't work like that. No,
Right.
it doesn't change your personality, like fundamentally who you are.
Yeah.
Right?
The only thing that can really change that is therapy. Your inner demons and you handling those things. And Matt, you would probably make a great therapist. So I don't know if you want to consider going down that route too, but I'm just kidding. No, but so overall, I mean, you mentioned it earlier. A lot of our military members, first responders do suffer from PTSD, depression, burnout. How does hormones optimize handling those different issues that a lot of our first responders have?
Yeah, I mean, anybody with like a TBI or has burnout or PTSD or whatever, I mean, they've obviously got like cortisol blunting, right? Where the cortisol is a stress hormone, and it's kind of a bad word in like the normal, in normal parlance and just the way that people talk, but it's not. It's a necessary hormone, right? And like it comes out in the evening and it allows you to like relax and get ready for bed. If you have blunted cortisol, which is common with people that do high stress work, high stress jobs, or have ever been in high stress situations, that cortisol release is blunted, and testosterone or just hormones in general help regulate that cortisol that cortisol blunting. It'll allow it to come back online. It also affects like neurotransmitters, an increase in dopamine and serotonin levels, all that stuff that's necessary for just your normal personality and things that get changed over time by your work and your life experiences.
Let's talk about like mental clarity. How does it impact like reaction time, decision making under pressure, and things like that? Would you say that sleep would also be related to that as far as helping people just stay, because I know for like me, like when I was in the military, for example, like having equipment on me, making sure that I had all the right equipment before I left the wire was extremely important. So staying in the game, not just looking physically great, but then also mental clarity. How does that play a role in that?
I mean, just obviously, I keep saying obviously, sorry. It's increased sleep, man. Like, increased sleep, increased energy levels, just, mental focus. Like, again, it goes back to like neurotransmitters. It goes back to your ability to get good, deep sleep, even in high stress environments.
Yeah, I guess the repair and recovery would be extremely important, like extremely paramount in that case. And one of the things I talk about on this podcast is survivability. And that's really why I think it's great that you guys are on the show today. I think that everything that you mentioned so far helps with both mental and physical survivability. What are some of the concerns that you've heard? Like people walk through your doors and they say like, well, I'm not doing it because of this or that. And what are some of those concerns and how would you like to address those concerns? I know you have to hear like 2 or 3 things over and over and over again. Would you mind sharing what you've heard from some of your new clients?
Yeah, no, absolutely. Cardiovascular issues, right? That's a huge one. I hear people say that like testosterone is going to give me a heart attack.
Yeah, like
give me a
heart attack.
stroke.
Okay.
Yeah. Or that testosterone is going to cause prostate cancer. That's another real common one. Or that testosterone, if I start testosterone, like I'll never ever be able to have children, right? That's another common one. So, with respect to the cardiovascular stuff, there was a huge trial that just came out called the Traverse study. I don't know, 2017, 2018, something like that, where they took like 5,000 people, men, and they put them on testosterone on TRT doses. And then they took 5,000 men as a control group and gave them placebo. And then they monitored them for years. And at the end of the study, they looked at the number of like what they call major adverse cardiac events or MACEs, and there was no increase in major adverse cardiac events in the testosterone group relative to the control group, which was huge, because I think for a long time everyone kind of assumed that the testosterone caused at least LVH or left ventricular hypertrophy, where like the left ventricle of your heart is a muscle, right? And if your muscles grow, like there's concern that the heart's going to grow also. Everyone's heard of like an enlarged heart, right?
Right.
Sounds like a good thing, but unfortunately what happens is the chamber gets smaller because not only does the tissue grow out, but it grows in, right? And so there's less blood to pump, and so it ends up in end organ dysfunction, that's a big deal.
I think a good point is testing in moderation, doing it in moderation in the care of doctors, providers, and who uses routine lab work to check on if you are doing testosterone too much, we'll lower your dose. If you're doing it too less, we'll increase your dose. We're not trying to make bodybuilders at all. We're just trying to make normal people feel better.
Have you guys experienced that where you've had clients come through the door and they're already like completely ripped and they're like, yo, can you give us like give me 3 vials?
Yes.
Yeah, all the time.
A lot.
And we have to turn them away. Although we're a business, we're still working in the medicine field. We're still a clinic. The end goal for us is to take care of as much men as possible.
Right.
Make them feel well, look well, and just be well.
Yeah, your reputation is at play when you start doing that sort of thing, and you might attract the wrong clientele, I guess, at that point, right? So you really don't want to open that can of worms.
Yeah, man, I got like a family and I got a mortgage and shit. Like I can't afford to have my medical license in jeopardy just to like make a couple extra $100, like it's just not worth it to me.
Yeah.
Right. And it just doesn't make sense. Like, I mean, we can talk about like, our ideals, like, and I don't want to do this because I'm like a good-hearted person or whatever, but no, it's like I don't want to do it because like I don't want to lose my license.
Yeah.
You know what I mean?
Yeah.
Like just realistically. I think there's another, going back to your question earlier, like one of the misconceptions or things that I hear about a lot is these bodybuilders that are like 35 and 40 years old that are dying on stage, right? There's been a ton of them in the last couple of years where these like 35, 40, 45-year-old dudes are just collapsing on stage, right? And everyone just jumps to testosterone and they go, hey, this is causing heart attacks or whatever. But I think realistically, I mean, I can't prove this, but my pet theory is that their H&H or their hemoglobin and hematocrit levels climb up because not only are they on testosterone, but they're using high doses of testosterone, plus a ton of other testosterone derivatives and diuretics, all these things that are contributing, right? But like their blood ends up getting really, really thick and they're not being managed well. right? Which is another reason like why you want to have a clinic do it. Their blood ends up getting really, really thick. And you can just imagine like if your blood's super thick and sludgy, like how easy it would be to form a blood clot. And if that blood clot like snaps off and it goes to your brain or to your heart, to your lungs, I mean, you're talking about scary shit. You're talking about like a heart attack, a stroke, a pulmonary embolus, you know, and that just goes back to like why it's so important to have somebody like manage your care.
Yeah.
You know, instead of just buying, you know, some $100 vial at Gold's Gym and just being like, okay, I'm going to take, you know, 500 milligrams today, and then I'll take 500 milligrams on Thursday, and just who knows? Let's see what happens.
So just want to ask, like, what's that management look like? Like, do they get blood tested every 3 months, 6 months? Like what would be the maintenance to make sure that people are staying balanced?
Yeah. So we do testing on initial visit. So we do total testosterone, we do free testosterone, we do a CBC, a CMP, a comprehensive metabolic profile, which is like liver function, kidney function, gallbladder function, electrolytes. Sorry, just to clarify, CBC is like all your red and white blood cells, so we can manage or watch your hemoglobin hematocrit levels along with everything else. And then we do a prostate specific antigen, which is like the prostate blood test that we do to make sure that you don't have prostate cancer, right? Or there's any risk of prostate cancer, I should say. But we do lab work on the initial visit. And then if we decide, again, collaboratively that it's like a good idea to start you on testosterone, we'll go ahead and like teach you how to do the injections there. If you choose to do injections, if you're choosing to do creams or gels, we'll show you how to apply. If you choose to do the pellets, which is something else that we can talk about, then we'll do them for you in the office. Or there's even an oral testosterone now, which is kind of interesting. Each type has costs and benefits to it. But so once we start you on testosterone, we'll let you run for 10 weeks. 2.5 months. And we chose 10 weeks specifically because that's kind of when testosterone starts to like take effect. And so we can bring you back in and have a conversation with you and be like, hey, how you feeling? Like, is this working for you? Like, do we need to increase your dose? Do we need to decrease your dose? Do we need to, adjust anything? Do we need to add an estrogen blocker in? Whatever the case may be, right? And then if everything's cool, like if all the levels look good and we're being safe and your testosterone's not too high and your hemoglobin hematocrit aren't too high, we'll let you run for another 6 months. We start doing labs every 6 months thereafter. If there is a problem, if your estrogen's too high or if your PSA is too high or your hemoglobin hematocrit's too high, whatever, we'll make a correction and then let you run for another 10 weeks and then bring you back in and test you again, right? So, and then, if everything's stable at that point, then we'll do it every 6 months. So yeah, it's just about good oversight, good management and oversight.
Yeah, and I think it's nice to actually have a working relationship with someone too, because I know some places will send you off to like a lab and they'll say, okay, we'll just go to this lab and go get blood tested and then we'll get back to you or whatever. But the fact is I can come and see you and say, hey, Matt, and have that relationship with you and know your background and who you are and trust you. I think that's the key with what your business offers, Ultimate Male, over others, which I think is really key. A lot of folks want to get into it because of the whole recovery side of it too. I mean, there's, getting injured, I know for me, like I have my back issues, I have shoulder issues, and then I've got to go to work tomorrow. Yeah. I've trained Brazilian Jiu-Jitsu like 3 times a week usually, and I'm sore as hell. And it's all about pain management at this point in my life because I've done things like gone to Iraq and worn a vest before and, and had to wear gun belts, things like that. And at any rate, the recovery. So how can your services help men bounce back from years of physical just wear and tear?
I mean, just hormone optimization, right? Like that's kind of like one of the main benefits of testosterone is that it aids in recovery, right? Sleep and recovery. We all know that experience where you've like taken a couple of weeks off the gym and you're like, shit, I got to go back. And it's leg day, right? And you do leg day and you haven't lifted in a couple of weeks. And then the day after leg day, you try and sit down on the toilet to take a shit. And like you can't like sit up. Yeah, you can't get up. You can't physically sit down, right? Testosterone, like, I don't want to say it like eliminates that, but it minimizes it. It helps to mitigate that, right? Like if you can only do chest like once a week or whatever, like your recovery is so much better that you could do chest twice a week. Or if you're on like a push-pull split or whatever the case may be, you can just do a lot more work, right? Going back to like the red blood cell thing, like that, the hemoglobin and the hematocrit, like it's kind of a double-edged sword actually, because, it's very, very true that you're at an increased risk for blood clots. At least that's what the common thought is right now. There's some interesting papers that are kind of refuting that, but like we still clinically practice, we have to manage elevated hemoglobin hematocrit levels, but like it's a double-edged sword in that like you've got more oxygen carrying capacity, right? You've got more red blood cells. It's just like EPO and Lance Armstrong. Like that's the whole point of EPO, is it produces more red blood cells so you can start increasing, hemoglobin hematocrit, your oxygen carrying capacity. You can do more work. You don't get gassed as easily. So if you're training or whatever, like you can go longer, you can go harder, That's the whole idea.
Yeah, so you can break through thresholds probably that you haven't been able to add extra plates or.
Yeah.
I think the recovery thing is huge for me because, like I said, I got to go to work. Like I train jujitsu. I train with 20-year-old kids, 25-year-old kids,
Yeah.
and they're full of just testosterone. They're full of like nothing but spunk and like just kick your ass. And so for me, having to rebound from those training sessions with them, because they're always looking to go after the old man, and try to prove something, and that's that's huge for me. That's huge for me. And Yuan, I wanted to ask you, how do you ensure the client's experiences overall? How do you ensure that the client experience reflects the clinic's values and high standards?
So we try to work with the patients, no matter on so we basically reach a mutual agreement with patients, right? It's not our decision to put you on testosterone. It's a mutual agreement that we both want to work on. We set a goal for you, or you set a goal that you want to reach with us. We give you the solution on how to do it clinically, safely, and a monitored way. On top of that, we do offer a bunch of payment plans, very flexible. You can do monthly installments upfront. Each has their own perks and quirks. They can even do like a 10-week plans, which essentially have them test it out, see how they want it. And if they want to move on, we can move on to the longer plan and something like that. But yeah, our goal is to get you well and within the reasonable budget that doesn't break the bank.
I think you've been the friendly face that I've seen across the desk for the last year or two, and anytime I've ever had any concerns or anything like that, you've always been able to work with me on things, and I really appreciate that.
I think it should be noted that, dude, Yuan runs the clinic, man. Like I could not do this job without him. Like this is a team in the truest sense of a word. Like I couldn't do it. He carries that cell phone with him 24 hours a day, right? So when patients are calling at like midnight or 3 a.m. or whatever, like, he'll get to it as soon as he possibly can. Right?
I'm going to take him up on that.
People do all the time.
No, just kidding.
Yeah. No, but he runs the damn clinic, and like he's literally indispensable.
It's a good team. I work on the business side. He works on the medicine side.
Yeah.
And sometimes we have clashes here and there.
We have clashes.
A lot of clashes actually on stuff that we don't agree on. And then we work it out. We talk like as a team, work things out in the best interest of our patients and the clinic.
Yeah, I've definitely lost my shit a few times.
You know what, though? I'm glad you mentioned that, because I was working on a training staff not too long ago. And on this training staff, we had some of the best when it comes to tactics and firearms and combatives and control tactics and things like that. We had some of the best, in my opinion, in the industry. And there was oftentimes we would close the door and we would have at it. And I said, look, guys, after we were done sorting out whatever it was, I would tell them, like, this is a good thing because we give a shit. Like, if we didn't care, like, if you think the Apple iPhone was made in a room full of yes men, you're crazy.
Right.
It wasn't. Like, it was created in a room full of people that had passion for creating something greater, and they did not agree with each other at times because they wanted to make something awesome. So the fact is that you just admitted that amongst your team.
Oh yeah.
That's real. That's authentic. And
we're on testosterone.
True that. So like you over here, you're definitely on testosterone over there, aren't you? I'm just kidding. No, man. So the stigma overall around men's health, how do you guys think that it's shifting overall?
Podcasts like this
towards like positive.
Yeah, totally. But I mean, like podcasts like this is just becoming way more mainstream, right? Like it doesn't have that steroid connotation that it used to. It was some hush hush type of stuff a long time ago, and I actually see that now, like with more like traditional or mainstream medicine, where a lot of these younger doctors that are like coming out of school are a lot more open to the idea and a lot more like willing to have guys look at their testosterone. Whereas like you get these old guys that, you know, went to school 30 years ago or 40 years ago, and testosterone causes LVH and it causes erythrocytosis, and like, no, you can't do it. I don't care if your level's 110, you know, or whatever. Like it's a steroid. Like you can't, no, it's not like that anymore.
Right.
You know what I mean? Like we can have, you know, thank God for podcasts, right? Because like it's gone so mainstream that like it's keeping us in business.
They kind of did the same thing with marijuana too, like early on, where they made it like this terrible thing, and it was the worst thing you could possibly do. And then testosterone was kind of lumped into that. I think it was a class or Schedule 1 drug in the 80s.
I don't know. It's a Schedule 3 now. But
well, it was a big deal back in the 80s. If you were caught with steroids.
Well, they had like the Lyle Alzado thing, and they had like the pro baseball thing, right? And like so Congress got involved, and it was a huge deal. Yeah. You know, and I think that the testosterone is separating itself from steroid use, right? Like TRT is fundamentally different than steroid use, right? They're both testosterone, but the dose makes the poison. You know what I mean? And like, and the observation is what matters. Like the management is what matters. Like having somebody just look at your friggin' blood work, you know, so you're doing this safely, or as safe as possible. I'm glad that you mentioned that. The difference between steroids and testosterone, and it has to do with the balance and the amount that you're taking, basically, is what it is. But then also too, there's other things that you need to take with that too, right? Like you don't just take TRT. A lot of times you have to take additional stuff like to help balance yourself out, or is that not for everybody? Oh, it's definitely not for everybody. There's a lot of docs out there, a lot of TRT clinics that will just automatically prescribe estrogen blockers. You know, one of the things that happens with TRT is that your estrogen levels go up. Every human being has this enzyme called aromatase, and basically all it does is it acts on some of the testosterone and chops it in half and converts it into two separate things. One of them's estrogen, estradiol or E2, and then the other one's dihydrotestosterone, right? And estrogen has this like it almost has like a bad word in, you know, amongst guys, right? Like you don't want to have soy or whatever, you know, like this high estrogen bullshit. But no, estrogen's a hormone, man. It's super important for all of us, but it's about the balance. You don't want to have too low estrogen. You don't want to have too high of estrogen. You want to be in the sweet spot, right? And if you just throw guys indiscriminately on estrogen blockers, you're inevitably going to crash their estrogen, or some of them, you're going to crash their estrogen. And when you start getting low estrogen, you're talking about like no sex drive, like dry joints, like no energy, no libido, like no ambition, nothing. And you're doing the complete opposite of what you're trying to do, what you're trying to accomplish, right? And so we don't throw everybody on estrogen blockers. We give people estrogen blockers that need estrogen blockers, right? Like there's not some like arbitrary lab value where we're like, oh, you get an Astrazole or whatever. Like it's how are you feeling, man? Are you having any breast tenderness? Like, do you have any itchy nipples? Do you have any emotional sensitivity? Like, you know what I mean? Like that's the kind of shit we're looking for. You ever have guys that aren't comfortable with telling you like, yes, I do have that or that? Or I mean, yes, maybe. It's in the phrasing. It's definitely in the phrasing. Yeah. You know, it's like if you start saying itchy nipples to people, they're a little bit weirded out by that. But like, you know, everyone can relate to like emotional sensitivity or you know, like I hear guys they'll cry at commercials when they've never done that before, right? That's another telling sign. You know, when guys tear up at commercials, like the SPCA commercials, the dog adoption commercials, right? But yeah, I mean, an Astrazole is like one of the, you know, it's definitely a healthy medicine. We just give you a low dose if you need one once a week. It's easy to take. There's other things that you can take too, right? So there's if you really need to maintain testicular function while you're on testosterone, we can add an HCG, or commonly known as Pregnil. Or there's like the whole sciencey part of it is like the pituitary gland releases luteinizing hormone and follicle stimulating hormone from your brain, and it goes down to your testicles, and your testicles are just factories, right? They produce two things. They produce sperm and testosterone. And that when you're on testosterone, any type of what people say is exogenous testosterone, or testosterone that's not naturally made, testosterone as a medication, that luteinizing hormone and that follicle stimulating hormone, that signaling mechanism gets cut off, right? And so what like these adjuvant medications do, like HCG and clomiphene, all these, is they allow that signaling mechanism to continue, right? So there are some guys that are that are legitimately like hypogonadal, right? Where they've got like testosterone levels in the hundreds or whatever, and they're symptomatic to it, but they're 30 years old and they don't have kids yet and they want to have kids. So like, what do you do in that circumstance, right? Like, obviously the gold standard is to not be on testosterone, but like there's certain circumstances where like, dude, you need testosterone, you know? Right. Man. And in those circumstances, you can use medications like HCG or enclomiphene, those kind of things to like maintain testicular functioning, right? Another thing that happens, one of the downsides of TRT is testicular atrophy. You know, like I think a lot of people want to downplay that, but like the reality is if you're on testosterone, you're going to lose like 30 to 50% of the size of your testicles, you know. And for somebody like me, I've been married for a long time. I got 2 kids. I don't care. Right. But there's a lot of dudes that do, you know, it's part of your identity as a man, like, you know. And so if you want to maintain that volume, that size, you can use those like adjunct medications to maintain their functionality, maintain their size.
Wow, you went right down a rabbit hole.
That was a rant. Sorry,
of nerd talk right there.
That was a rant. Apologize.
But no, it all totally makes sense though.
Matt's really good at explaining things, especially in the biology part, science part. I had no interest in biology or science before, and after you explain things, it kind of makes sense. I guess that's what our patients think too. Like you make things relatable and explain things really, really well.
I like to know why, you know, and I want people to tell me why. Like, why are you doing this shit? Like, what are we doing this for?
Yeah, and you know, there's so many things that I want to ask about. Like, when do you know? Like, when do you know the time is right for you to go get checked on your testosterone? Like, is it an age? Is it the way you're feeling? Like, if I'm someone listening to this right now, how do I know that I need to go get my testosterone levels checked?
Yeah, that's just totally subjective, right? Like if you ask, you know, somebody, they're going to say, you know, if you're symptomatic to it, right? Like if you don't have that libido that you used to have, if you're getting fatter, if you're not putting on muscle as easily anymore, if you've got low energy, but that's everyone, right? Like that's everyone. Yeah. I mean, my personal feeling, and obviously I'm biased, but like my personal feeling is that testosterone should be included in annual physical labs, right? Like it's so important for men and just functioning generally that like when you go to your physician and you know get your annual physical labs along with the CBC and the CMP and the TSH and all the normal labs and shit, the A1C that they do, I think total testosterone should be included in that because it's so important in like just maintaining, you know, optimal performance and just general like quality of life.
Yeah, that's actually really huge.
We see men coming in every week or so. We literally see their changes in energy level, their happiness. They even look a little bit like bigger, and some of them show significantly good sleep. So some people come in with like eye bags before, come in like fully sleeping, like clear mind.
Are you talking about me?
No, not you.
I'm just kidding.
Even with us since the beginning.
G patient. Yeah, man. Yeah, I mean, it's been great for me. The best part, I think, is about where you're located. So let's talk about that. So where are you guys located specifically if folks are interested in checking out what you have to offer?
So right now we have 3 locations with West Hollywood and San Gabriel being the main locations for Ultimate Male. We also have a satellite location in Downey where men can get in and checked out, receive the same amount of service. It'll be the exact same quality. So yeah, visit us. We're right on Sunset Boulevard in West Hollywood. San Gabriel, we're right by I-10, so it's pretty close to anywhere pretty much. At Downey, we're on the Lakewood Boulevard location. So yeah, it's a pretty convenient drive for everyone in the different demographics in LA, basically. But yeah, we're trying to expand and get more locations out there so we can help more men.
Do you guys offer any kind of mail service right now? Like if folks come in, they get tested, and then they find out that they need whatever and they just don't have time to come pick it up, do you guys offer any kind of like dropping it in the mail and sending to them right now?
Are you talking about mail like M-A-L-E or M-A-I-L?
M-A-I-L.
I'm just
mail. Yeah,
I'm just fucking with
mail service. I'm looking at you, Matt, when I say mail service. Chippendales, Thunder from Down Under.
Yeah, man. We build custom plans for people, right?
Yeah.
And like, I'm only licensed in California, so we can't ship out of state right now. I do work with a supervising physician, right? I'm a PA, so in California, like I have to be working for a supervising physician. Dr. Nyberg, he's an awesome dude. He's a retired interventional radiologist and now does this basically full time. But we will ship to anywhere in California if need be, right? Like we're just building custom plans for people. That's the whole idea, you know, is that like it's just the personal touch, right? That's kind of what separates us from everyone else.
Your plan is made for you and you only. There's no I want to say there's no two same plans.
No
per se.
cookie cutter, like, you know.
Yeah. So basically, if you want to come in, pick up like a 2 month, 2 time supply, and you're traveling out of state, traveling for like 4 months, getting deployed, something like that, we can work with you. Always, we'll try to keep your testosterone supply as needed, as long as it's within the regulation range.
Yeah.
I mean, we have a ton of guys that get deployed all the time, and like we figure out how to make it happen, right? Like that's just standard operating practice for us.
That's great customer service right there. Now you have a whole nother side to the business that deals with the women's side, but we'll talk about that another time. I just wanted to cover, I mean, it's such a big business that you have like two sides to your actual physical location and to what you guys are doing as well. And as we're rounding out the end of this podcast, I just wanted to make sure I covered everything. Was there anything that I didn't mention during this podcast that you probably would like to cover or talk about, or just go back over again and make sure that people fully understand the realities versus the facts versus the falsehoods about TRT?
I think one thing that we could elaborate on for sure is that there's different types of TRT, right? Like we kind of alluded to it earlier,
Right.
but there's like, obviously injections are the most popular and most
Oh,
well
yeah.
known, right? Like
Right.
injections take 2 minutes and they're awesome, and I can get your levels up, as high as we need to, in the top quarter of the range, whatever, really easily. But there's other options. There's a lot of guys that don't like needles or whatever the case may be. There's creams and gels, right? Which are also very popular. What we've been doing a lot of lately are pellets, which are these little like Tic Tac things that we insert under the skin above the muscle into the subcutaneous tissue right there, and it just stably releases testosterone over time, right? And it lasts for like anywhere from 4 or 5, 6 months sometimes, so you do it like twice a year, and that way you don't have to deal with weekly injections, but it just keep your levels stable throughout. Those are really, really popular. And then there's another medication we use called Kysotrex, which is a new FDA approved oral testosterone that you take twice daily. They're horse pills, man. Like they're big old things, but you take them twice a day, and like they're really convenient for some people, right? And some guys, testosterone's just it's not appropriate for you, but there are other solutions. There are other options. Another one, a great one, is enclomiphene, which is becoming really popular right now. It's a derivative of or an isomer of this well-known medication called clomiphene, which is used in like the fertility space and a lot of women's health stuff. But what it does is it allows it basically sends your pituitary on overdrive, and you just dump out a bunch of FSH, which is the signal that tells your balls to produce more testosterone, right? LH, that produces more testosterone. So you start like intrinsically producing more testosterone. So we can get your levels up pretty darn high with just that too, right? So there's a bunch of different options.
Yeah, man.
And definitely the aesthetic side as well. Matt does a lot of laser treatments here for lots of men, believe it or not.
Yeah.
Botox, fillers, hair resolutions. One of the more significant side effects is if you have male pattern baldness and you still want to get on testosterone, we do have something called the Power Hair Solution, which I'll let Matt go over the sciencey part. But yeah, essentially it helps you grow more hair, gets more volume, prevent hair loss. But yeah, the science part.
Yeah, one of the the big problems we kind of talked about it earlier is that like testosterone aromatizes. We talked about that enzyme, how it turns into estrogen, and the other thing it turns into is called DHT, or dihydrotestosterone. That's the chemical that's responsible for male pattern baldness, for hair loss, right? So another common thing that we hear is like, oh, am I going to lose my hair, right? That's a real common thing that people ask. Nope, you will not lose your hair. What testosterone will do is that will increase the probability of your hair loss if you have a dad, an uncle, a brother, somebody like that that's close to you that lost their hair around that same age. It increases the risk of that happening for sure. Some guys do lose some of their hair for sure, but it doesn't, just because you're on testosterone doesn't mean you're gonna lose your hair.
I like what you mentioned earlier about the options, because some people don't like needles.
Yeah,
some
no, for
people
sure.
can't even fathom like stabbing themselves.
Bro, I have guys, like I draw blood and I have guys pass out on me. They vagal out and literally they'll pass out. I'm putting their legs up in the air and shit and like, dumping water on their head. Yeah. It happens all the time, man. Guys just don't like needles. They'll be all sleeved up, like full tattoos or whatever.
Yeah.
And I take this little needle to draw some blood.
I got to get over it, man.
Yeah.
Yeah. No, I was part of a combat lifesaver course when I was in the military, and I've seen untrained people like stick IVs and other people, and you got to get that angle. And I've seen people directly stick at a 90-degree angle into the arm, and you see their face just turn white. Like, yeah, that they'll never come back from that ever again. So,
Yeah.
Yuan, was there anything that I mentioned in the podcast or I didn't mention in the podcast that I should have mentioned?
I think that pretty much covers it. To add on to the hair loss part, that's why we have the medical spa right attached to us. Essentially, they have amazing PRP machines, PRP microneedling specifically, that grows your hair back a lot more. Probably will lose my hair at some point because my dad and my granddad have melt pattern baldness, so I'm pretty aware of the hair loss space. So that's why we came up with the hair loss solution and all the PRP hair. But it's all amazing treatments that you basically do every 6 months or a year to help you retain your hair and yeah, make it look fuller.
And this is all evidence-based too. This isn't like we're not experimenting, right?
Yeah.
Like this is all, there's papers that justify like what we're doing and guide us, right? Like we do a lot of erectile dysfunction management. That's another huge thing that we didn't even touch on today. That's like a huge part of what we do.
You guys do so much, man. I mean, you can't even fit it into a podcast.
Yeah. Yeah. I mean, erectile dysfunction management is like it's a world unto itself, right? But everything we do is based on current scientific literature, right? Like we're scouring papers all the day and reading journals and like talking to people and having conversations and trying to not just like keep up with the Joneses, but like innovate also, you know, like, but do it safely and in a way that's effective.
Yeah, you've seen a lot more acceptance with TRT. I mean, we just came off the heels of 2 wars that went on for 20 years. And you're talking to a combat veteran right now, and I can tell you that I've known more people that have benefited from this, and it's helped them out with their just staying in the fight, with their jobs, with their family, keeping their moods, great. And the recovery is huge too, because I'm a very active 45-year-old male, but I'm over here fighting 25-year-old kids that are trying to rip my head off. So for me, it's really important to to be able to recover, to go to work the next day, to feel good on the weekends when everyone expects you to feel good. So it's helped me out quite a bit over the years, and I really appreciate the customer service that you guys have offered me and given me over the years. It's been great, man. And I love going in and seeing you guys. I know this sounds like an infomercial, but I think this is probably one of the longest relationships that I've had with this sort of support, with my health, because I've moved around so much my entire life. And I've changed doctors and things like that. So
We're flattered.
Oh, I really appreciate you guys, man, for coming on the podcast today. And I hope this isn't the only one, that we can do more in the future and have more conversations as well.
We just scratched the surface, man. They're so deep.
I know.
We can go so deep.
I know. We didn't talk about the women's side. We didn't talk about the hair growth stuff. So, I mean, there's so much to talk about. I didn't even realize it.
Yeah, weight loss, ED, everything, we can take care of you.
Yeah. But I mean, I think one thing I want to make clear is that, like, testosterone is not the be all end all solution, right? It is a tool that we can use to help optimize performance and recovery. Right. It's a wonderful tool for people specifically that are first responders, that are soldiers, that are deployed, that are firefighters, police officers, anybody that uses their job physically or that uses their body in a physical way to make their life. Testosterone is an extremely important thing that you should be aware of.
Yeah, and also doing it responsibly.
Yeah, doing it responsibly.
Because the gym I used to go to, I knew guys in there that were doing trend, they were doing like stacks of other stuff. Yeah. And to me, that's scary. Like when I'm getting advice from someone that drives a forklift on my health and my body, like I'm not doing that. So I'd rather go to a professional that knows and's been there before. And your background, Matt, I mean, that's a great compliment to what you're doing today and the advice that you're giving out there. So no, I think Ultimate Male is a great place for people to go.
Definitely our pleasure to have everyone here.
Yeah, we love it, man. Like, I'll be doing this for the rest of my life. Like, I found my niche. This is what I love to do.
Well, let's have you back on the show again to talk about some of the other things that you guys offer at some point in time. And, I'll definitely cut out some great clips and hopefully get some folks more educated out there and more awareness. At the end of the day, that's the most important thing, right? Is making sure people are more educated and we break the stigma.
And feeling better.
Exactly. Ultimate Male is a great place to go. And, TRT is not just about getting the edge back. It's about making sure that you show up for your family, staying in the fight, living with purpose. Whether you're a veteran adjusting to a civilian life or law enforcement grinding through your ever-changing shifts, or maybe you're just a guy that wants to feel like himself again. These are the tools that can help support you get there. Big thanks to Matt. Big thanks to Yuan for joining me today on the podcast. Make sure you go to ultimatemale.com. check out the journey of the entire business, as well as Instagram at Ultimate Male Clinic, right? Are you guys on any other social media platforms?
We're on Yelp, but I'm not sure if that's
Google, Yelp, Instagram, soon to be YouTube, hopefully.
YouTube?
With your help.
Yeah, with my help.
Yeah.
Okay. Yeah, man, no problem. I know a few folks that are looking to put and it's important to have, your reputation out there. Businesses like yours that offer authentic help is absolutely essential for us to make sure that we don't, get a bad reputation for what TRT has to offer. Because at the end of the day, it does have a lot of great benefits, especially for our veterans and our law enforcement and first responders out there. So.
For everyone. For
And we do have some specials for listeners too. So if anyone comes in, we can offer them some deals, which we'll send in a bit. Yeah.
Sounds good, man.
Thanks, brother.
I really appreciate it. Thank you guys for joining me on the podcast, guys. And for everyone else out there, as always, I want you to stay tuned, stay focused, and stay motivated. Warriors, fall out. Hoorah.